The doctor I'm seeing today, I'm not going to reveal who he is or the name of his business, but he is my psychiatrist. And one roadblock he ran into was when he was naming his new practice. He decided to open up his private psychiatry practice. And the proposed title had the words Psychiatric Associates in the title. He was urged by his accountant that he should call it Medical Associates and not Psychiatric Associates because Psychiatric Associates, the word psychiatric scares people off. So at the end of the day, he decided to use the word psychiatric or the words psychiatric associates, but he also had to go around to all the neighbors in his office park and explain to him that he was not treating crazy people and that people like us were not violent. He had to go that extra mile. And I'm wondering why that is. You know, if you have diabetes, you go to the doctor and you take medication. If you have bipolar, you go to the doctor and you take medication. But for some reason, having that word psychiatric in this business name was advised against. It was seen as a deterrent, seen as something that people would not want to be a part of, and it also scares people. They're scared of us. We're a very scary group of people. We are psychiatric patients, and we are scary, and we are on the rise, and we are violent criminals, and we are going to take everything from you, and we're going to hurt you and your children. I think that is the overall impression, but then you could take a look at me. All I really want to do is feel better. That's about it. It's pretty simple. Just want to feel better. I'm not violent. I'm not a threat to myself. I'm not a threat to others. I'm not a thief. I'm a moral, ethical, functioning human being like anybody else. But once you throw the word psychiatric in there, I become non human. I become psychiatric. A psychiatric patient, a mentally ill person, someone that's not good enough, someone that's going to cause trouble, someone that's going to hurt you. So, oddly enough, he stuck with Psychiatric Associates and his business is working out just fine. But just the fact that he had to sit around and convince all the people around him that we were not going to burn down the place shows you something. It shows you about how people are looked at as psychiatric patients, as people with psychiatric illnesses.